While calf hypertrophy might seem like a minor concern to someone, but for others, it can significantly impact their life opportunities. In fact, several airlines use calf size as a guideline for selecting cabin crews, or some girls lose the opportunity to be the model just because of their calf size. My name is Manapee from Estique Clinic, and today I bring a decade of experience in calf reduction here. Calf combines with a high proportion of muscles and a slight fat. Therefore, when we want to reduce calf size, we aim at the muscle part for the effective treatment. This can be a complex treatment because while we want to reduce muscles, we need to ensure that the calf muscles will maintain its function as normal. Therefore, calf reduction is a challenging procedure. In the past, calf muscle reduction involved direct surgical muscle resection. While this method effectively reduces muscle mass, it can cause serious complications such as a compartment syndrome and muscle fibrosis, which affect gait control. Consequently, alternative techniques were developed. These days, there are two popular methods for calf reduction: surgical selective neurectomy and radiofrequency nerve ablation, or RF nerve ablation. While selective neurectomy can be effective, it carries the risk of complications such as hypertrophic scarring, muscle compensation leading to bulging in other areas than the gastrocnemius muscles, and potentially loss of sensation in the lateral side of the leg due to resection of the surocutaneous nerve responsible for lateral leg sensation. In contrast, RF nerve ablation is associated with a fewer and less severe complications. However, it typically results in a lower reduction of muscle mass compared to surgical selective neurectomy. The reason is because RF nerve ablation mostly targets only at medial gastrocnemius nerve. I have a strong intention to develop the result of RF nerve ablation. During my research, I discovered that certain journals discuss the benefits of multiple selective neurectomy procedures, targeting not only the medial gastrocnemius muscles, but also the lateral gastrocnemius muscle and soleus muscles. This approach aims to reduce complications such as muscle compensation and optimize the overall outcome of the procedures. Drawing inspiration from the articles, I have designed a treatment strategy based on the concept of multiple selective neurectomy to improve the outcomes. Instead of surgical procedures, I will be implement RF nerve ablation that will have pretty much the same result with surgical selective neurectomy, but a significant lesser potential for complications. And I would like to present you the result of this case study to demonstrate the effectiveness of this approach. This case is a 38-year-old woman. I have conducted some investigation by using ultrasound, and the result of her calf muscle thickness was shown in the pictures. As you can see, her medial gastrocnemius muscle is quite thick, which can see from the size of each component in the pictures. For this case, I designed the treatment plan by targeting 4 nerves: the medial and the lateral gastrocnemius nerves, as well as the medial and the lateral soleus nerves. I conducted a follow-up assessment at 3 months, and the results are in the pictures. The muscle bulging has significantly diminished, and the calf appears slimmer than before. The ultrasound result before and after RF nerve ablation revealed substantial changes. Initial measurements of the gastrocnemius muscles, ranging from 1.5 to 1.98 cm, decreased to 0.82 to 0.94 cm. Initial soleus muscle thickness between 1.94 cm and 2.23 cm decreased to range of 1.36 to 1.62 cm. These measurements illustrate significant reductions. The gastrocnemius muscle size decreased by approximately 44 to 55%. Soleus muscle size decreased by approximately 27 to 34%. Furthermore, overall cup size experienced a noticeable decrease. The initial cup size for both legs was 37 centimeters. After the procedures, the left calf measured 33.5 centimeters and the right calf measured 34 centimeters. As you can see from this case, the result quite satisfied to both the patients and myself. Also, this is the evidence that the RF nerve ablation can have a similar result with the surgical selective neurectomy, with the significant less chance of complications. I have applied this procedure in over 10 years, and I have identified several significant benefits from using this cup reduction technique I developed, giving a better result by targeting both the gastrocnemius and soleus muscles, reduced chance of muscle compensation, ability to correct any compensation, if any, by using the same technique, targeting specific bulging muscles. This is the example of the muscle compensation effect that she did in somewhere else that I corrected by using RF nerve ablation technique. Scarlett procedure with the flexibility to repeat the operation as needed. Utilization of machine to detect the superficial cutaneous nerve or pseudocutaneous nerve, minimizing side effects such as loss of sensation in the lateral aspect of the leg. This is a case I have just finished before making video record today. I used the step I mentioned earlier by RF nerve ablation, and the result is so satisfying. With these benefits, I have confidence that the technique I've developed is not only safe but also yield results close to selective neurectomy with fewer complications. Or if complications occur, we are able to make a correction unlike other techniques. This approach is effective and efficient, and I hope it becomes widely adopted, allowing patients to have their desired cup appearance and achieve their opportunities in their life. Thank you.